welcome. Quote Me on That podcast is an initiative of Quote This Woman Plus. Quote This Woman Plus, also referred to as QW Plus, is a gender justice organization that links women plus experts to the media. Quote Me on That introduces our Women Plus experts to the world.
Welcome. In today's episode, we speak to Lebohang Rikhotso, a public health advocate working for Humana People to People South Africa on a sex work program in Limpopo, one of the country's most underserved and often overlooked regions. Lebohang is also a QW Plus Voices Fellow, part of Cohort 1. And in this conversation, she opens up about the realities of HIV prevention on the ground and what it means to center dignity, care, and safety in a system that often forgets them. Welcome, Lebohang.
Thank you so much. And I'm glad that I got invited to this episode, and I'm very much grateful to share my stories and my experience in the field of HIV and AIDS, including working with the key and vulnerable populations.
Fantastic.
Thank you.
Fantastic. So Lebohang, tell us your backstory. How did your journey start in terms of advocacy and within HIV, TB space?
Thank you. Like I've mentioned, I'm Lebohang Rikhotso, born in Soweto. I grew up there. I was born in 1989. I think in 2005, I completed my grade 12. So at home, there was no money for me to further my studies. So I met one of my friends who was working at Humana People to People in 2006. I think by then I was 17 years old. Then she told me that they want people that will work in the field to educate communities about HIV and AIDS. Then I told her that, no, this is not my thing. I'm not interested in that. Then she was like, no, you just go to the class, they will teach you. You just give people information, you give them condoms, you refer them for testing. It's not difficult. You can do it. And you get the money at the end of the day.
Yeah.
So me coming to Humana, I don't want to lie, it was basically that, okay, I'll save money and go back to school.
Yeah.
It happened that I attended a 2 weeks training, 10 days counseling class. And also after 2 weeks, I went to the field. So I was allocated a field and my target was to reach 2,000, to work with the population of 2,000 people in giving them information on HIV and AIDS.
Yeah.
There was this one day, I'll never forget that day in my life. I entered a household, I found an old lady doing laundry outside. I greeted her, I told her my name, I'm from Humana, I work with HIV and AIDS, and that lady was so angry with me. She asked me, do you know HIV? Are you HIV positive? I'm like, no, I'm trained. I know I'm qualified for this job, I'm trained. Have you seen someone who's HIV at your home? Is there someone who's HIV? I was like, no, I've never seen someone who's HIV, but I saw in the TV, I saw people from the magazines, from TV, because now in those days, we had stories like Soul Cities and, doing prevention programs in the radios and in TV so that people, they can be educated on HIV. So basically the information on HIV, it was everywhere. Then the lady was like, let's get inside the house. Then we went to the bedroom. She showed me a bed where I couldn't see anyone in that bed. Then she was like, do you see my daughter? Then I was like, no, there's no one. I uncover and I remove those blankets. Then I removed the blankets. I saw her daughter there. I cried. And she was like, you come here, you tell me about HIV. You see, this is my daughter. She was diagnosed with HIV in KZN. And she didn't go to the facility to get medication, but instead she was buying medication from one professional nurse who was, if she has money, she will buy medication, which is ARV, and take those ARV. When she doesn't have money, she will not take ARVs. So now I was called to come and get her from Eastern Cape because now she's bedridden, she has TB, she has pneumonia, she's sick. And last week, I'm from Rustenburg. Did you see those two kids outside, those that are twins? Their mother passed on. Now these kids, they are also HIV positive, and their mother is my daughter. And these kids also, they have TB. And my husband, he's an alcoholic. When he comes back home, if he wants, he will hit me. And you come here and tell me about HIV. don't come here and tell me about something that you don't know, and tell me about the theories from class. You know, I went back to the office. I told them that this is the end of my journey with Humana. I didn't come here for this. My journey was for me to work, give people information, condoms. Then they get the information. They decide whether they want to use information or not. This is not what I came here for. I went home. I talked to my mom, and I was crying when I get home. Like, I was feeling pity for that woman. I got home. I told my mom to say, this was my experience today, and I'm not going back there. Then my mom told me that, no, think about it. You went to Humana because you wanted money, but maybe God is showing you something. Maybe this is the kind of job that you wanted because you want to be a social worker, and this is aligned to what you want. Go and help that family. That's not my responsibility to help that family. I don't want anything. But after 3 days, I kept on thinking about that old woman, and the fact that the old woman was also in an abusive marriage. Then it hit me hard because my mom was in the same situation, and I also realized that I was not also triggered by the experience of me seeing someone who's bedridden for the first time, but I also have my own childhood traumas that I have not dealt with. And I was like, if something can happen to that woman, I will not forgive myself. That woman needs support. I went back to Humana. I told them that I think I'm ready. I want to go back. I want to go back and see that family. And from that day, my life never changed. I enrolled in unis. I did project management. You know, I did courses on public health. You know, I was interested to know more about HIV, advocacy, human rights, because I felt that, you know, there are many families that are like that one, but no one is helping them. And I've been working for Humana for the past 19 years. I've never worked at any other place. I've been in Humana for some time, and I've been working from different programs.
Yeah.
And in 2019 until 2022 in June, I was based in Pinetown. I was supporting programs in Eastern Cape and Gauteng.
Yeah.
Before we got this funding for sex work program. Then it happened we get the funding for sex work program. So when they advertised for a program manager, I was like, this is the type of program that I want. I don't want to sit in the office and support this program. I want to be hands-on. I want to be together with sex workers in assisting them to change their lives. I will not do much from head office. Then I applied for the job. My supervisor was like, do you want to leave head office? I told him that I'm not. I'm very grateful that I was now in the head office. I've seen myself growing within the organization, but I feel that I will not be able to do much when I'm sitting here. I feel that I need to go to Limpopo, start the program, and be together with the sex workers, educate them, and ensure that we reduce the spread of HIV, TB, and STI among sex workers. And mostly about educate them about their human rights, because most of the sex workers, their human rights are being violated. They don't even know where to report. Some, they think that no one will take us serious, but we need to help them to understand that even though you are a sex worker, you are still a human being, you are still a mother, you are still a sister. So you have the same right like any other South African who has rights. So we have equal rights. So I came to this program in 2022, July, and like I feel like my purpose has been fulfilled. In the district, we are reaching over 3,000 sex workers. We ensure that they get tested. Those that are HIV negative, we initiate them on PrEP. Those that are HIV positive, we ensure that they are initiated on ART. And we also have group activities whereby sex workers, they address their challenges and they also learn from other peer sex workers. And the other thing is also, we've seen sex workers also growing with parental skills. We also have family days whereby we teach them about, because when we started the program, we had a lot of sex workers that their children were taken away from them by Department of Social Development because of negligence.
Yes.
And some, they were even doing sex work in the presence of their children. But that, it has reduced. In a week when we started, we'll have 2 or 3 cases. Now in a quarter, we are able to report 1. And in some quarters, we report 0 of sex workers that they did take their children. So we are educating them to be better parents, We assist them to open bank accounts so that even the money that they're doing during sex work, they can save the money. And now we have, last year we started economic empowerment program. Some they found employment under EPWP in the farms. 2 of them, they went back to school. Some of them, they are now having IDs. So we see the life of sex workers changing. We know that we will not be able to change all the 3,000 their lives, but we also see the decline in number of HIV incidents amongst them. The sex workers, you know, when we started, we'll report high numbers on quarterly basis on HIV positive sex workers. But now in a quarter, if we have a lot of sex workers, then we'll have 3, and those that new in the program of those that have stopped PrEP. So we see that our interventions, they are working. And we also have a high rate of PrEP retention. Most of our sex workers, they are on PrEP. And we see currently we are sitting at 87% PrEP retention, and which for us is a huge achievement. Bearing in mind that we work with sex workers, and even on now we are in the campaign of 1.1 million campaign, and we are working together with the facilities to ensure that they provide us with the list. We check if we have sex workers that have stopped treatment, and we want to ensure that they are back on treatment. And the good part is most of our sex workers, I think we only found 3 of them that they were not on treatment. Most of the people, they were from the community, but we are working with the facilities. We see that our adherence support groups, they really work, and sex workers, they are taking their lives to ensure that they are safe, and also mostly that their clients are very safe. And we also continue to provide sensitization workshops, because, you know, some people, they might think that as an organization that we are promoting sex work. We all know that sex work in South Africa is still illegal. But we are educating them that we cannot fight HIV and AIDS as a country, excluding sex workers, because amongst ourselves, we can give each other PrEP, we can give each other education. But if your partner goes and sleep with Lebohang, who's a sex worker, not using condom, the sex worker is not on PrEP, or the sex worker is not on ARVs, your partner will be infected, then they will bring the HIV home, and you also be infected, and so forth. So we are trying to make them understand that we are not promoting sex work, but we are saying sex workers, they are there, and we have to acknowledge that they are there, and we need to ensure that they get services also for us to reduce the spread of HIV and AIDS within the country, so that by 2030, we are able to achieve our targets as a country.
Fantastic. Thank you so much, Lebohang. Oh, my word. So from what you've just spoken about, you were using a few acronyms that I know because I'm from your world, but listeners wouldn't know. So can you explain to us what PrEP is? That's the first thing.
Okay. PrEP is pre-exposure prophylaxis. So it's ARVs that we give, or medication. So before you test for HIV, if you are HIV negative, then you will be initiated on PrEP. So PrEP is medication that you take so that you prevent yourself from getting HIV. So it's before exposure. Hence, we are saying it's pre-prophylaxis. Then we have PrEP, which is post-exposure. So for sex workers that experience condom burst, or maybe they are raped by clients, then we also ensure that they get tested. And if they are HIV negative, then they are initiated on post-exposure prophylaxis to ensure that they don't get HIV. Then after 28 days, they will be tested again to ensure that they are HIV negative. But if you are tested after being raped, then we find out you are HIV positive, meaning you were HIV positive before you were even being raped at that particular time, then we'll provide counseling and ensure that the client is initiated on ART.
Okay, fantastic. Thank you. And just for those people who are not aware of ART, we're talking about antiretroviral therapy, right? And then there was a second question. You spoke about the 1.1 campaign. So that is the 1.1 Close the Gap campaign. And that is people who have been on the program, that have left the program for whatever reason, that we are now going out to go and find actively, right? Okay, so I just wanted to bring those two things to the fore. So really, I mean, if anyone's listening to this, you are bubbling with enthusiasm. What keeps you committed to this work? I mean, we know it's not easy work, and we know that sometimes it's not recognized. So what keeps you motivated?
I think what keeps me motivated is, the results, the impact of the program. I'm the program manager. I'm not on daily basis in the field because of other commitments, meetings, trainings, and so forth, a lot of traveling within the program.
Yeah.
But when I get to receive reports, I don't just see numbers. I see human beings beyond those numbers. And I ensure that even within the organization, we ensure that we implement quality services. The team that I work with, they know that we rather report zero than reporting high numbers whereby people, they didn't get services. So what keeps me motivated is seeing people receiving our services, seeing sex workers changing their life, seeing children of sex workers going back to school, seeing children of sex workers having some birth certificate, seeing sex workers opening bank accounts for themselves, seeing them even using the sex work money to build homes or houses for their children, seeing someone who didn't even want to know their HIV status, who has tested and now on ARVs, and now we don't have to follow that person. The person will even call to say, sister, tomorrow is my appointment for viral load. For me, it's this to say, seeing sex workers now opening cases. We had a lot of cases whereby sex workers, they were sexually assaulted and they will not even want to open cases, or they will go and open case and they come and close them because the client had given them the money. But now we see sex workers, really fighting for themselves to get justice. And when we also see, because our programs, they are based on funding. And also now we are working on sustainability. We are educating sex workers the importance of going to the health facility, because Humana will not be there forever. So we see sex workers going to facilities, going to SAPs, opening cases. And also as when we are sensitization, when we are doing sensitizations to healthcare workers or police in the police stations, when we see that now the policeman understands the type of work that we are doing, and also that they also provide respect, even when they handle the cases of sex workers. They will not say, no, you were raped because you were wearing a miniskirt. They will treat them with respect and dignity. So it's those things that, they keep me motivated. And today we have a sex worker who called us to say, I'm tired of using drugs. I'm tired of using drugs. I just want to change my life. We made phone calls with service providers or stakeholders that we have. Today, we escorted her to rehab. Is this seeing sex workers taking charge of their lives and want to change their life? That's what keeps us motivated. And also to see that, these interventions, we don't have to take them light as if like we are just reporting numbers, but it's, people's lives that we need to focus to ensure that sex workers, they have a better tomorrow.
Oh, I love it. I love it. I love it, Lebohang. Thank you. So now that we are talking about sex workers and you have been speaking about some of these things, I would like you to talk about what the biggest barriers are for sex workers in terms of accessing healthcare.
Can you repeat the question? I didn't get it.
What are some of the biggest barriers sex workers face when trying to access healthcare?
Some of the barriers is discrimination, stigma and discrimination in the health facilities. Hence, we are conducting sensitization workshop. Our sex workers, they were retained in the facility. They will tell you that in the past 7 days, we are here, we treated you with STIs. This week, you are coming again. Last week, you were here, you took 100 condoms. Today, you are coming, you want condoms. And also, and also that we have transgender sex workers within the program. So when they get to the facilities, they will be discriminated and be insulted by health professionals. But with the sensitization, we see that changing. And we all know that it cannot just change like that. Also, it depends on people's attitude. But with the sensitization workshops, we ensure that they understand that we will not achieve what we want to achieve without excluding the sex workers. So now with the sensitization workshop, the health professionals now, they are welcoming to sex workers. And we also see, even when we go to subs, they even call us, when they have GBV campaigns, they say, call those sex workers, they need to be part of us because we are marching and fighting for their human rights. And we go to Department of Justice, we have very good relationship with Department of Justice, because Most of our sex workers, their human rights, they are being violated. Some, we go and assist them with protection order and, you know, to ensure that their cases, they get justice. They really work with us. And now, because they understand the program, they are treating sex workers with respect and dignity.
That is amazing, Lebohang. I mean, I've also worked on a sex worker program a while back. And what you're saying, everything it resonates. But just to hear the impact that you're making as an organization and even as an individual. And I think the lens that you're using, it's person-centric, it's human-centric, it's amazing. So thank you so much for sharing that.
Yes.
My next thing is, if you could change one national or provincial policy to improve the outcomes for sex workers, what would it be?
I think if I have to change the policy, I will legalize sex work. Because we've seen the gaps within the policy. Sex workers, they were denied access to services like healthcare services, even social services and justice services. Most of the rape cases, they were not reported. Some of the sex workers, even if they have STIs, they will not go to the facility because they are scared to be judged and so forth. So if we can legalize sex work, but also come up with better guidelines to say, as much as we legalize sex work, but these are the guidelines that people need to follow, because we also, it's not like we are also promoting sex work, but we are saying it's there. And sex workers, they have, you know, they need to have legal rights like any other people in South Africa. So if sex work can be legalized, we see that they can be more cases being reported from sex workers. We will see more sex workers having access to healthcare facilities, because as organizations, we are not here forever. We also see now that we have very few resources within the NGO space. Hence, we are pushing to say sex work need to be legalized so that sex workers, they can use available services in the communities, in the local facilities, in SABS, in Department of Social Development, in Department of Justice. They should just go there like me and you, accessing services without being discriminated, without being stigmatized, or without being judged, or even being denied services because you are a sex worker.
No, thank you very much. So yes, I know working with Sweat and with the Sonke, just how the fight for decriminalization is an ongoing one. And I love the fact that you just explained why we need this decriminalization, because there are people who would go, are you promoting this? And I love the fact that you just unpacked it. I hope that those listening will understand that we're coming from a human-centric perspective, but also from an HIV prevention perspective, and also access. I mean, we have a constitution that speaks about democracy and about access. And so this is exactly what we're asking, without any prejudice, that sex workers be allowed to access the same things anyone else is able to. And then we're going to move on now to the fact that you are part of, quote, this Women's Voices Fellowship. What shifts have you seen? What has it meant to be part of the fellowship?
What made me to be part of the fellowship is, you know, I like the idea of the fellowship because I work with the marginalized populations, the sex workers. You know, their voices, they are not heard. No one will listen to a sex worker because first and most, they are being judged. So I thought that it's important for me to enroll in this fellowship to enhance and improve my skills on advocacy, and also to learn how I can pass messages on human rights for sex workers, and also how I can even motivate sex workers to speak up for themselves and also to take charge of their lives. And with the fellowship, it really helped me to understand much more on human rights. I'm working with a mentor who's really guiding me on issues on human rights, on issues on advocacy, and also what other interventions that we can provide within the program than what we are funded for. So it really helps me. And now we have started in social media, we are writing about our work. People are engaged in the activities that we are doing. And I'm also giving my fellow colleagues the very same information, because I think we are 41 in the program. And I believe that if the 41 of us, we are equipped, then all of us will be able to, our voices of sex workers, they will be heard. And even if it's today, maybe tomorrow, the president will hear that we really need decriminalization in the fight against HIV and AIDS, and also to ensure that, sex workers, they have access to, healthcare facilities. As much as now, the Minister of Health launched the 1.1 campaign for people to go back to treatment. You might find that most of them are sex workers who just left facilities because they were discriminated, they were stigmatized, or they were even denied access. So now we are saying, let's work together as a country to ensure that each and every South African, they have access to healthcare, access to justice. If I'm being stigmatized, or if I'm being sexually assaulted, I can be able to go to the police station and open a case without being judged, or without fear of being victimized again.
Mm-hmm. Thank you so much, Lebohang. I even want to just add on that even if you're not South African, but you are on the soil, you are living on this land, then you should have access. Because remember,
that's true.
It might very well be South Africans that are in relationships with those who are not from South Africa but living on the soil. So I also just want to make that that call that the services should be for anyone who is within the country, so that we can ensure
that's true.
That we really do eradicate HIV, and that we do make sure that human rights are upheld. Thank you so much for that. We are at our last question. What advice would you give a young woman who wants to do meaningful advocacy work, especially in under-resourced places?
The advice that I can give is, even if you don't have resources, there are a lot of things that you can do as a person. You can start even from not having anything. There's a lot of information. I think now we have access to information. There's internet, there's a lot of information, there's a lot of research that you can find. There are a lot of policies, there are a lot of guidelines, there are a lot of SOPs. But young people, they should not limit themselves. Young people, they should be in the forefront addressing issues that are affecting people within the country, because as soon we'll go to old age. So we are really relying on young people to continue where we will live, or where we'll come, because we come from far. When you look at that time for TAC, whereby they were fighting for ARVs, and now we have access to ARVs. Everyone have access to ARVs. And now we've been fighting for PrEP. People now are having access to PrEP. And now we are still fighting. We know there's still gender-based violence. So young people, they need to join hands together with us to ensure that we have a safe environment for everyone, and to ensure that wherever you are, even if you are in a deep rural area, do not say, I don't have resources. Get connected, with even a local NGO, go there, volunteer with your time, make an impact in the community. The little that you do where you are, it means a lot, because it will change a life or two, or you will change even a life of someone that you didn't even know that they needed that information or those services. So as young people, let's not fold arms and wait for others. Let's join hands together to ensure that we create a better environment for all, and also a brighter future for all.
Thank you so much. That was Lebohang Rikhotso, reminding us that real care doesn't come with conditions, and that justice means showing up without shame for those who are pushed to the margins. If this episode gave you something to think about, share it, tag us, follow Lebohang Rikhotso, and make space for voices that are changing the story, one conversation at a time. Until next time, keep quoting Women Plus. Thank you, Lebohang.
Thank you.